Hello everyone. Um, I'm here to present you Bharat TeleClinic business model presentation. So predominantly we found the gap in the market that there are some lot of people in the rural area. They face a lot of problems in terms of distance for the infrastructure gap, and then there are some people who face the problem with a long wait, crowded hospital, or overworked professionals. There are some gaps in terms of healthcare workers versus the number of patients. So, for example, the population versus the healthcare professionals in the country. We also see there is struggle in managing the lead to poor adherence and outcomes of the pharmacy. Let's say the pharmacy stores, retail stores. So providing solving this all the problem, we have come up with the kind of an telemedicine, or I would say the teleclinic, complete all-in-one teleclinic solution, which includes the telemedicine, televital measurements, telepharmacy dispensing, which is equal to teleclinic. How does it work? So technically, when the patient comes, they see on the screen there are two kind of a button, or there are many buttons on the screen. One of the button they press, which is called doctor for 199. The moment they click on the doctor come online, and doctor checks the patients, asking patients a few questions, and then if the doctor wants to diagnose patient with vital measurements, so there is a vital measurements also included in the machine itself. So there is a BP measurements, oxygen level measurement, there's a sensors for the thermal body temperature, and then there is a kind of a phone receiver to patient to have a private conversation. Doctor can see in a video call, doctor can see in a patient clearly, very high quality HD video quality doctor can see, and doctor can have a conversation with the patient smoothly and conveniently. This will be like a completely 5G technology inside for the data transmit. And also there is a let's say the for the weight and height, there's a two sensors are provided. With these sensors, doctor can check the patient's BMI, and then once the consultation is over, the doctor will dispense the medicine remotely, and the moment they press the button, the medicine will come out from the vending machine itself. This will be controlling the dispensing the medicine through. Well, we don't allow patients to dispense the medicine themselves. They have to consult the doctor, or they have to consult the pharmacist. So consulting pharmacist is free. So why we have created the free? Because many of the people they might, or they are confused in terms of whether they need a consultancy or we don't need a consultancy. So technically the pharmacist will decide whether they need a consultancy or no. So if they don't need a consultancy, if there is a kind of an OTC medicine can pharmacist can dispense, so registered licensed pharmacist will dispense the medicine from the uh, remotely. So remotely they can dispense the medicine from. So this business model covers with a lot of sensors and lot of technology insights. These technologies are under certification right now. And then if I give you a highlight of the sensors, so there's a height detector, weight detector, there's a camera for the video call, there's a 21.5 inch, enough for the persons to see the buttons and name of the buttons and interact with the screen properly. There's a phone receiver, the person can have like patient can have private conversation. There's a 2-inch screen which displays the many of the vital measurements and whatnot. There's a body temperature sensors. There's a BP, blood oxygen, heart rate sensors. There's a loudspeaker, so the patient can loudly can hear the sound of the doctor. And then there is a printer for the receipt to come out. Whether it is to do with the vital measurement report, or maybe we can say medicine report, and the complete diagnostic report can be come out from the printer itself. There's a card reader. People can pay credit card, debit card, or as well as the QR code. They can scan the QR code and they can pay. There is a is completely secure and protected by all means. I would say the weather conditions and many other things, which is secure and protected by the technology. No one can actually break out access to this medicine inside. So why we see there is a huge market, because currently this is a completely new category in terms of teleclinic, in terms of telemedicine or something anything else. So currently in India, we have healthcare estimate about 160 million, 160 billion, sorry, and then growing cigar to about 22%. Telemedicine alone, 5.5 billion, and the pharmaceutical business, let's say the retail medicine business, is about 12.46 billion actually. So our target audience is urban and rural population seeking accessible healthcare solution, patients facing the barrier like distance, long wait times, and medication affordability. We are addressing market needs is to fulfill the needs of the convenient, affordable, accessible healthcare services, target the underserved communities and biggest healthcare disparities, provide the solution for timely consultation and medication management and vital measurement. Our business sizing in growing market opportunity by offering an innovative telemedicine and telepharmacy service through our teleclinic machine, catering to the diverse need of the India healthcare landscape. We wanted to make this as an impact business model. So we have splitted those business model into small different segments. So I'll start with the first thing called a BOCO model, beneficiary owned and company operate. Technically, we partner with NGO and government to give us a list of the beneficiaries. Example, Gram Panchayat. Example, any kind of a slum area where this medicine, so teleclinic vending machine or teleclinic pod can be deployed. After deploying that, this is completely funded by the NGO, the corporate partners, or any of the partners to fund it completely. So we deploy the machine and we operate there. So our obligation is to operate, completely provide the medicines, supply of the doctor availability, and maintaining the teleclinic code. So we see there is a kind of a package to offer, not only for the machine itself. We also see there is a package for the number of patients to get benefit out of it. I would say 1,000 patients to get 100% discount on medicine cost and doctor consultancy fees. So there are a lot of other offers are available, which is being donated by the donor through NGO, and so that we offer that kind of things at the vending at the teleclinic board. So technically we see there is a kind of need of this. Basically there are a lot of people cannot afford to have a medical support, so they can press the free button and they can get the medicine and teleconsultancy free from the teleclinic board. There's not require any kind of healthcare professionals to be there. It's completely automated. So then when you press the button, the technically the doctor will come on the screen and they explain every single thing, and they consult the patient easily. In our model, we sell the machine. From the machine we take about 20 to 30% margin on selling the machine. Then we have another model which is for the completely with the franchise owner and company operate, which is to do with the some example, any of the company wants to have a machine for their employee welfare. So we deploy the machine there. We don't share any revenue. We don't share any kind of thing. We sell the machine for 20-30% margin, but we don't share any kind of a revenue with them. But we completely operate for their employee welfare. Is it to is it supply the same thing? If the corporate wants to don't want their employee to pay and they wants to pay, so then it applies the same thing. So technically they also get the package out of the entire business model. Then after that we have lot of doctors help a lot of doctors are available in India. So they connect remotely. So technically they get like about 199 or 150 average order value, or I would say 199, starting from 199. And they get so we take the commission of 30% from there. So this is how the whole thing works. So in our medical business, so medicine sells basically. So we do not want to sell non-generic medicine because we wanted to cover the average order value, not cross or maybe exceed more than 150 rupees. So we wanted to make sure that the generic medicine, whether the doctor prescribe four different type of medicine or five different type of medicine, so the patient can afford those kind of medicine in a reasonable value, reasonable cost. It should not exceed more than 150 rupees or maybe 100 rupees or something. So technically we have that kind of margin to it. So basically we sell the medicine, we source the medicine from the wholesaler, and from the wholesaler we sell that medicine to the patients on the teleclinic board. So our margin stands for, let's say, literally 40 to 60%. It depend on the MRP value. It depend on the medical. It's depend on the manufacturer's cost and every single thing. Then we have entrepreneurs who are actually wants to start a teleclinic board in their town or in their village or maybe in their locations. So they purchase the many number of teleclinic board, out of which we share the revenue with them, including telemedicine fees, the medicine sales, and many other, to cover their operating costs, to cover their. So for the other model, in this model, technically we don't share any revenue or anything with anybody. So we that also cover themselves the operating costs and the property rental value or anything. So they will cover in their cost. Here in this model, we share the revenue because they purchase the many number of medicine, teleclinic board. So technically we supply the medicine, also we give them a training and promote and whatnot, and they completely operate the medicine. So this is our unique selling point, is the diverse revenue stream we have, ensured sustainability and scalability of this completely business model, social impact through NGO partnership and village outreach, lucrative margin across all flexes and business models actually. So now, if you look at India, we have a huge opportunity in terms of deploying the machines. So we have you can see them on screen right now. There are 7,349 railway stations. There are about 1,700 Domino's pizza stores in India. Then we have 1,000 farmer mandis we have in India. So and so. If you go through all the list, so there are total about 40 lakh total locations are available. Our aim is to reach at least 10% of those immediately with our NGO partner, with our corporate partner, with our CSR partner, and many other partners we are in discussion right now. So here's our timeline. It's already started. We have deployed the machines, yeah, in this starting from the 1st of April, and then technically we are going to do kind of, let's say, the trial with the 1,000 patients to understand exactly how the demand and supply is across the entire business model, including supplying medicines to how many types of patients are coming, what kind of a consultancy is happening, and whatnot. It's in short, we are doing a um, market MVP testing of the minimum viable product testing to the machine, hardware, and display app, doctor app, backend admin app, and medicine supplier app. So, and after this completion of the 1,000 patient trial, we will enter into the next trial, which is more than 10,000 patient trial, which includes the 20 machine, and then we'll deploy the 20 machine in the many of the villages in near to Mumbai. And then there are some slums in Mumbai. There are some religious places like famous temples, and then there are university campuses, hostels. Then there are some tourist spots and the transportation hub. So we are going to deploy the 20 machines to do the trial for the 10,000 patients in that area. Here's our entire software ecosystem, or I would say the complete software how it is aligned with each other actually. So machine sourcing deployment to all the way to the integrated with the cross platform administration. By the way, we are integrated with ABA. We are integrating with the government portals and government records and every single thing. This will benefit for for doctor to understand patients' historical data and whatnot. So ideally, the machine sourcing deployment applications we have. So it's completely managed 100% through the technology, and then we have a beneficiary information, and then at the end we have a stakeholder reporting at the end. So we have similarly that medicine wholesaler inventory management application, we have machine IoT patient display application, we have doctor aggregator platform application, we have integrated cross platform administration and whatnot. So we are not going to stop here. We are going to communicate very heavily. We are going to utilize the almost all the marketing channels to ensure and make sure that our message is pass across all the stakeholders, and then the benefit out of this entire operations. So we have digital marketing, we have corporate partnership and whatnot. There are many other things are available which we are going to implement, And then we see a competition in the market with which Practo, Tata MG, all those companies are actually providing telemedicine services and delivering medicine at home. Similarly, there are a lot of differentiations also there. And then there is a competitive advantage, convenience, affordability, innovation, social impact. Our soon we will be getting endorsement from those government department. So here we are three co-founders, myself, Yunus. We have Devang Bhai, we have Praveen Bhai, and we all of us we are working together on this project right now, and we are going to build and deliver this thing as quick as possible in the market very soon. Thank you so much.